Unboxing Careers. Welcome everyone to the Unboxing Careers podcast. I'm your host, Greg Zackwitz. On today's episode, we explore a career in physical therapy, our second one with Doctor of Physical Therapy, Ashley Katzenbach. Ashley, welcome to the show. Thanks for being here.
Thank you for having me. I'm really excited to talk about my favorite topic, physical therapy.
And you are in New England area, right? Cape Cod?
Yes, I'm in Cape Cod. Been here for 20 years. I've lived here my whole life.
How's the weather right now?
Today it is cold. Yesterday it was foggy and raining. And the day before that, I think it was snowing. So you never know what you're going to get here in New England.
Beautiful. Typical
Yes.
New England for you.
Mhm.
All right, Ashley, let's start with this. Let's do some level setting. So just quickly tell us a little bit about your role, how long you've been in the field for, and we'll just kind of pick it up from there if you don't mind.
Sure. So I have been a physical therapist for 20 years. I started out in an outpatient clinic, was there for 16 years, got tired of that, decided to open my own practice, and I have been running my own business for the past 4 years, and things are going well.
Very good. So how did you decide on physical therapy as a career choice?
Yes. So as a high school athlete, I had some injuries, just some nagging wear and tear injuries. I had some shin splints. I went to physical therapy and I thought, you know what? Looks like so much fun. I could picture myself doing this. So my high school guidance counselor had me take one of those career aptitude tests that I'm not sure if we use those anymore, but at the time I took one and it said, I could be a physical therapist or a nurse. So I decided to go the physical therapy track.
So the aptitude test was correct. Unbelievable.
Yes.
Did you have a sense of maybe what you wanted to do outside of physical therapy before, or were you, like most other high school people, not really decided at that point?
Well, I think I thought maybe I could be a lawyer. I was very, argumentative, opinionated. I'm like, maybe I'm going to be a lawyer. But otherwise, no, I had no idea. It just looked so fun. It looked so rewarding. Yeah. It was a busy clinic. There was lots of people. The energy felt really good. And I got better. So there was also leaving with that positive feeling.
Very good. We'll talk about some of the rewarding aspects and whether, what maybe misconceptions
Sure.
kind of got into there a little bit later. But let's talk about education for a minute. So we've had a previous guest who was a physical therapist assistant on and kind of walked through. There is a difference because I introduced you very quickly, but I said you're a doctor of physical therapy. Mm-hmm. So let's walk through kind of your path, but typical education for someone who wants to go into a physical therapy career. I know there's different tracks there, but walk us kind of through what you did and your perspective of going through, if you don't mind.
Sure. So my path, I went to school was what's called a 3+3 program. So applying to school, I went to Sacred Heart University in Fairfield, Connecticut. And, I applied to school and I was accepted into the physical therapy program, which was contingent upon me maintaining a certain GPA in my prerequisite classes. So I entered school, took 3 years to get my bachelor's in exercise science and psychology. So I finished that up in 3 years, but I didn't graduate with my bachelor's yet. Started my fourth year, which was actually my first year in the master's program. After that first year, I received my bachelor's. And then 2 more years, I received my master's in physical therapy. My class was the last class at Sacred Heart to receive their master's, and then they transitioned into the doctorate program. So at the time, oh, sorry, go ahead.
Oh, no, continue on.
At the time, as a new grad with my master's and seeing everyone was transitioning to the doctorate program, there was a fear. I'm going to have to get my doctorate. They're not going to, what's going to happen here. So maybe a year went by, and then I got my doctorate from Temple University. My employer at the time was kind enough to help me pay for that. Otherwise, I'm not sure if I would have been able to do that so close to graduating.
So I want to go back a little bit. So perfect transition. That's my bell to ask you a question. So can you just graduate the program without getting the master's, without getting the doctorate, but without getting the master's and go into a physical therapy role? Or do you generally need the master's to go into the physical therapy world?
Yeah. So at the time when I graduated, the entry-level degree for a physical therapist was a master's.
Okay.
Currently, the entry level degree for a physical therapist is a doctorate. There was a
Okay.
time where the entry level degree was a bachelor's. There are still physical therapists practicing today that have a bachelor's in physical therapy, and that's the entry level degree. And they're practicing and they have 35 years of experience and they're fantastic physical therapists, but they have a bachelor's. So, if you have a fancy degree, but you have 2 years of experience, you have a bachelor's with 35 years, I'm going to pick the one with 35 years experience.
Makes sense. Uh, let's talk about transitioning from education into the real world. So you're
Yeah.
making that transition. Obviously, you have a lot of qualified people applying for the same types of jobs. There's tons. You can do physical therapy all over the place, right? Sports teams need them. High schools need them. Colleges, you have private practice, things like that. So hospitals. Walk us through kind of what you did going in, and it's kind of some of those realizations people should expect coming out and getting into their maybe first or first not entry level job, but like the first maybe 5 years of the role. What should they realistically be looking at?
Well, I think when you're in grad school, you're doing your internships or your clinical rotations, and so you want to try to figure out what might you like to do and apply for those internships, those clinical rotations. So when I was in grad school, I did a variety of different rotations. I did one at a hospital where you see. I did a wound care rotation, an acute care rotation in with like strokes and brain injuries and spinal cord injuries. Um, I did one in a skilled nursing facility. I did one in at the Coast Guard Academy where you saw really fast paced, lots of orthopedic injuries. And so I realized I did not want to work in a skilled nursing facility. I did not want to work in an acute care hospital, right? So I realized I didn't want to do those things, but I did like the outpatient setting.
Okay.
So when you're going to apply for your first job, you try to do the things that hopefully you're doing something you want to do. But when I graduated, I applied at a few different outpatient clinics. I got a job at one of them. And then I worked per diem on the weekends at a rehab hospital because I wanted to keep my skills in a variety of settings in case I changed my mind.
The preference toward the outpatient facility was the preference, was it like personality driven? Was it the type of work? Was it just something you saw in the other things, like whether it's injuries or the type of work you're doing that didn't really resonate as much with you than the outpatient setting? What was it about that decision? Was it more internal, or is it the type of work, or maybe level of empathy you need?
Such a good question. I don't know. I think it just felt like this is the place for me. I think that
Yeah.
was so internal. I love using my hands. I can't imagine not being in a setting where I can't put my hands on a patient and help them in that way. So being in a setting where there's not hands-on care, where there's not manual therapy, I wouldn't. I don't think I would do well in that setting. But that's a great question. I think it really was that like internal match for me. It just felt like this is where I'm meant to be.
And then with the outpatient setting, did you have, or maybe this is more of a broad question, in your experience, do most of these outpatient places, do they have like specialties? So you're dealing more with sports injuries or shoulder and elbow versus leg type stuff, or is it just kind of a round robin of the type of clients you have coming in?
Well, I think when you graduate, it's a really a round robin, and then you decide what am I passionate about? What do I want to get really good at? So, and as soon as you graduate, you feel like you know nothing, right? You got there, and I'm like, I know nothing. I am not prepared for this job. I am in way over my head, But if you're lucky, you've picked a job that has really good mentorship, that has you've surrounded yourself with great people that know what they're doing, and you've set yourself up for success. Also, you continue to take classes. I mean, the first couple of years, I must have taken so many manual therapy classes because I just felt like I was completely in over my head, which I think is normal. It seems like when you first go to work, you feel like you know nothing. And then 5 years in, you're like, I've got it. I've totally got it. And then another 5 years, I know nothing. And then you've got it. And then it's just the cycle. The more you know, the more you realize you don't know nothing. But
Makes
it's that
sense.
to keep learning.
Is there Do you have to go through continuing education in order to keep your license on a either yearly, bi-yearly, or semi basis?
Yeah. In Massachusetts, every state's different. Every state has
Sure.
different requirements. For a while, Massachusetts, where I practiced, did not have continuing education requirements, which is odd. We still took them anyway because you just want to keep learning. Now they actually do have requirements, which is great. I think we should all have to keep learning, keep your skills up, keep up with what are the new recommendations, what are the new research guidelines. But so we're caught up now, Massachusetts. We have to take classes.
Perfect. And is that expense? Do you pay for that? Does your employer pay for that typically? How does that generally work?
So every practice is different. No one's required to pay for classes for you, but oftentimes that's an incentive. So an employer might offer as a kind of like a recruiting package, like we offer, unlimited continuing education. We offer $1,000 a year. We offer, $500 a year, whatever it is. But it's generally an incentive to get people to come work for you because most physical therapists want to keep learning.
Perfect. And then let's talk a little bit about advancement. So you mentioned a few minutes ago that you worked for a company for, I think it used to maybe said 16 years and then transitioned to starting your own practice. So is that a pretty typical career advancement for people? Is that more so just someone entrepreneurial? Walk us through maybe those first set of years into kind of mid-career and then where most people wind up settling.
Oh, it's a great question. So I don't know if my path was typical. My first job was for kind of a bigger company. I don't know if we want to name names, but it was for like a big company. You were
They can Google it.
Yeah. Okay. A big company, and it was one of those companies. They had you take a personality test, right? They broke up those personality tests again, and they saw, what, your personality matches for management. So we're going to fast track you. And so I think by year 2, I was like a manager for that office, right? So you're seeing patients, but then you're also managing other therapists as a 2-year graduate. So not wasn't the best situation for me. I obviously love treating therapists, but I didn't think that was the best situation for me, even though apparently my personality they thought was the right fit for that. So my one of my colleagues in that practice decided to leave and open up their own practice. So I went with them. So I say I was with the same practice. It was because everyone else in that practice also went with that same person. It was with the same group of people, but in a different office that I'd call more of a family style, a mom and pop operation. So got to treat the way that I wanted to treat with the people I wanted to treat, the same style, but without having, 6 or 7 bosses to report to and not caring so much about the direct units and how many units I was billing and how many units everyone else was billing. I could just focus on good quality care. I was with that group for 8 more years. And then my employer at the time decided he wanted to retire. And I'm so happy he was able to retire, but that meant he sold the practice to a bigger group, right? Because how do you retire when you own a business? I think you probably have to sell the practice.
Yeah.
But that meant it was to another big group, and that meant more direct units, billable units. And I didn't want to do that anymore. So I left there and went to another small practice and was there for 5 years. So 5 years, I went to work for another company, a smaller group, but I ended up running this practice for another person and built this practice up, loved it, ran it like it was my own, had so much pride in the organization, hired people. We grew this great family. It was wonderful. I loved it. But what ended up happening is I essentially was running a practice for someone else. And I felt like they didn't really appreciate everything I was doing. And that's not really the reason to leave a place. That was okay with me. But I was seeing 4 patients every hour, going home with documentation. I didn't really feel like I was able to treat patients in the way they needed to be treated. I'd see someone, I would be doing hands-on care for 15 minutes while shouting across the room to the aide that my other patient was doing the exercising correctly. It just wasn't a good feel. It didn't feel like me. I also turned 40 and I realized I'm going to have to do this for 25 more years before I can retire. And that was a really scary thought. My financial planner said, yeah, you can't retire for a long time. So I figured there's got to be a plan B. So I changed.
That's good. So there's like three things I want to jump into here, and I don't know which one to do because you touched them on all. We finished with the kind of salary last, right? Retirement and stuff like that. So I'm going to jump there real quick, and then we'll circle back. Salary expectations, right? Mm-hmm. My assumption would be, and I've been to physical therapy plenty of times, including last week, that they make a pretty comfortable living, physical therapists. But there are, like you said, probably based on the practice you work for, what those are, work-life balance with that. So can you try to pinpoint, I don't know what that is, kind of typical salary expectations or like ranges people should look at? Where do you normally start out at? And then kind of if you're, say, not a business owner, plugging through, walk us through that a little bit.
Yeah. Well, I can tell you that when I started practicing in the year of 2006, right, my starting salary was $50,000, right? So in 2006, as a new grad, $50,000 is what I started in Massachusetts. Now, Massachusetts is like the third lowest reimbursed state for physical therapists in the country. I can tell you that. When I left my job in 4 years ago, what's that math? 2022, as a manager of a practice, seeing a lot of patients, way too many, right? I was making $90,000 in the third lowest reimbursed state, right? And so in order to make a salary and keep the lights on, you have to see a lot of patients. So you can only get paid what you bring in.
And you're generally getting paid based on the number of patients you're seeing, not just like a flat fee, show up, no one's there one day. Right. Gotcha. You talked about kind of different organizational structures. This is always changing, right? We have large physical therapy offices and conglomerates. Now we have private equity buying into healthcare facilities and kind of doing what private equity does with those things. I look at it from the outside and I see a changing industry. Is that a realization that's actually happening from maybe like an internal perspective? How should, maybe the better way to ask this is, how should people think about the career as it's evolving now, as they're going through, if they want to work in it? What should they kind of plan for with these changes that you're, seeing in the industry?
Well, a couple of things. I can tell you that every single day I get at least one offer in my email or one phone call offering to buy my business from some kind of an equity firm, right? I will say that it's evolving, and I would recommend anyone that is going to school to also take some kind of business class, right? So you're going to physical therapy school, you're going to anything health related, also take some kind of business class. I wish I had. I'm figuring it out as I go along right now. So I think it would be helpful to have a better understanding of how this all works. I think we have to be a little bit more creative. I mean, the need for physical therapists for healthcare isn't going away anytime soon, but how we deliver that healthcare, I think, is going to continue to change. I would love healthcare to be available to everyone I'd love it to be available to everyone for free. I'd love it to just be a universal right. But unfortunately, it isn't. So in order for me to give people the healthcare that I think they deserve, this is the model I have to give it in.
Yeah, makes sense. And I love the advice. You see that in a lot of different degrees. Even pilots will tell you, I wish I would have taken business classes as well, right? Because they kind of have chances of economic downturns and things like that, right, out of their control. How about the competition in the field? So if I'm coming out of college, look at it for one of those entry level. Is it a really competitive field? Is it average, moderately competitive? How should people be looking at how easy will it be for me to generally get a job, even if it's at a larger conglomerate or whatever?
It is not hard to get a job at all. There is no shortage of jobs. the issue is that sometimes in an area like Boston, for example, where there's a lot of physical therapy schools, there is a lot of competition that people want to have jobs right there where they went to school, and it's a great place to live. So the areas that people want to live, and there's a lot of schools around there, there's going to be a higher, less available jobs. But you can go to a rural area and have a job and get paid very well. It just depends on if you want to live there or not. There's a lot of areas, not-for-profit hospitals, and a lot of rural areas you can go and have your student loans paid off if you commit to working there for a certain amount of years. There's jobs everywhere. You just may not want to live there. So there's no shortage. It just depends on what kind of life you want to live.
Perfect. So it sounds like there's pretty good flexibility there to kind of suit your lifestyle, even if it's, your lifestyle at the moment, right? Because people change through the 20s, 30s, and even in the 40s, and probably beyond.
Yes.
So how about personalities and temperaments that make you either better suited or worse suited for a career? I'm assuming if you have no empathy whatsoever, probably not the ideal career for you, but walk us through some experience from either what you've seen personally or from others about, hey, if you have this, it might be a good personality for you.
Yeah. Well, it's interesting you say empathy, right? When I first graduated, a couple years in, I felt like I had almost too much empathy, which I know sounds strange, but it's that fine line between not wanting to hurt someone, feeling so badly that they're in pain, but then knowing you have to push through to get them better, right? So I find that you can feel for someone, but you can't let empathy stop you from helping them get better. So empathy is a tricky one. I find my mom tells me I may not have been born with enough empathy. But so I think that empathy in the outpatient world, where you have to put the patient's needs, like where are they trying to go, what do you have to do to get them there, sometimes above that short-term pain or discomfort they may be feeling because of the goals they've told you. So maybe if you have a lot of empathy, if you feel really emotionally, if you feel very deeply, that outpatient world may not be the right one for you. You might be better off in hospice care or pediatrics or working in a skilled nursing facility. So I do think you're right. I do think knowing yourself and knowing, can you move beyond your emotions for the greater good of that patient?
I love that answer and the perspective with that as well. So you kind of go up and down that chart for different places based on that. How about patients? Do you have to, physical therapy is not an overnight success type thing, right? You don't get a vaccine and you're like, oh, I'm good. Do you need to be extremely patient? Because you're probably dealing with people in not great moods most of the time as well.
Yes.
How much patience do you think it takes from someone?
It takes an incredible amount of patience. It takes infinite patience, and it takes understanding like how much you can handle and learning about yourself. So I know in my day, right, I have to be mindful about how I schedule my clients. So I treat a lot of patients with chronic pain. And so I know on my day, I may only schedule myself maybe 2 or 3 patients that have a lot of chronic pain, and then schedule myself a few female athletes that were working on injury prevention, and then maybe schedule a few patients that maybe were working on some tendinopathy, because the patients that are very emotional and require a lot of your energy, mental energy, are going to take a lot out of you. And so you can't have 8 of those patients in a day because you just don't have enough of you to give. So those patients, those clients, right, require a lot more patience and a lot more mental energy than maybe some of your younger athletes that maybe require a lot of physical energy, and you're working on the long-term plan. So I think knowing yourself, setting your day up, setting your week up for success.
Perfect. And You probably alluded to some of this already, but I'm going to ask it anyway. So if we look at kind of the most challenging parts of the job and then the most rewarding parts of a role or a career in this field, what would you say those two kind of dichotomies are?
Most rewarding and most difficult?
Yep.
I mean, the most difficult is when someone doesn't get better, right? The most difficult is the complex patient that you have worked so hard, you've researched, you've troubleshoot, you try to get them to the right specialist, the right provider. You study the articles, you've tried all the treatments, the experimental treatments, and you just can't find the answer, right? The answer, you haven't found it yet. And we're in the practice where we're not going to, if we can't do it ourselves, we're going to find the right person, but you just can't figure it out. That is the most frustrating, most difficult. You pour your heart and your soul into this patient because you care so deeply and you can't figure it out. That is the worst. On the other hand, the best, right, is seeing someone get better. Someone you have worked with, a patient that has osteoporosis and had a compression fracture and thought that their life was over, but you've shown them how to rebuild their bone and they can live their life and have longevity and they can pick up their grandkids now. I mean, their whole life has changed. It's the best.
When you are dealing with difficulties, like the example you gave where, the patient's not progressing and you're frustrated or kind of heartbroken, whatever the term is, Can you leave that at the office or does that go home with you?
Oh, it goes home. It goes home. It would be great to leave it at the office, but it doesn't.
Is that a traditional, like a typical challenge for the job, do you think?
I think it depends on who you are, right?
Yeah.
I think
How much empathy you have?
Yeah. Or it's just, your brain doesn't stop thinking. And you know what? It is a skill. I went to a workshop this weekend with some other business owners. And one of the workshops we did was called Yoga and Resiliency. And we were working on, as business owners and as physical therapists, trying to leave it there, coming up with an end of the day routine where we try to learn, okay, what's the end of the day routine we can learn where we can just shut it down. I have done enough today and leave it at the office. So it's a skill. It's a skill we're trying to continue to learn. I've been trying to learn it for 20 years and I haven't got there yet, but I'm going to keep trying.
Yeah, you'll get there. Ashley, how about some things that people should know going into the field that either no one tells you or that you are commonly finding people are surprised by?
You will never know it all. You will never know it all. There will always be more to learn. It is okay to say you don't have the answer. It is okay to tell a patient, I don't know, but I'm going to figure it out. I think that patients value and respect you if you tell them, I don't know, I think it's this, but we're going to figure it out together. I think that listening to a patient is the most undervalued skill. And we don't learn that in physical therapy school. The ability to listen to a patient. If you listen long enough, they will tell you exactly what is wrong. There is no special test or diagnostic imaging that is as effective as listening.
Very good. And is there anything maybe I neglected to ask you that you feel is important for people to know as they're deciding whether to go into this career or not?
I think that if you're thinking about going into physical therapy, you should also consider being a nurse practitioner. If I could go back and do it again, I wonder if I should have been a nurse practitioner, right? A nurse practitioner can be a bit more autonomous, maybe could make it on their own a little bit easier. I don't know. I am very happy where I am, but if I was starting today, maybe I would go that route instead.
I was just going to ask you, if you had to go back, would you follow the same path you did?
Yeah.
So that's really interesting that it said nurse practitioner. My follow-up would have been, what would you have done?
Yeah. I think that you get the ability to help people and help, but I feel like one of the constraints with physical therapy is we can't order an MRI and X-ray. We can't prescribe medications, right? Even though we maybe in our skill set, our toolbox, we know that's what they need. So I hope that the way our profession is going is that we're working towards a primary care physical therapy model. I hope that we're moving in the direction where we can have primary care wellness, a physical therapy wellness. Like you go see a dentist twice a year. I think you should go see a physical therapy twice a year. I think we should have wellness instead of let's be proactive instead of reactive.
With the real quick before we wrap up here, but you mentioned, hey, I can't prescribe something to someone. If you think a medication, we'll just say an anti-inflammatory, right? But like if there's some sort of prescription medication you think would help someone, are you allowed to say, hey, you should ask your doctor about this, or is that an ethical boundary that you're not allowed to cross?
Nope, I do it all the time. I do it all the time. And it's great because I have some great relationships with physicians in the area, and I will call them and say, this is what's going on. This is what I think they need. What do you think? And oftentimes they just, because we have a good relationship and I've spent a lot more time with the patient, there's generally not a lot of pushback, but I think you just form relationships and that's what this is all about, like collaborating with, the local practitioners and forming a relationship with them so that they trust you, I trust them. And we have the patient's best interest at heart. It's not about who's right, who's wrong, who has all the answers, like what is right for the patient.
Very good. Well, Ashley, thank you for your time today. It was a pleasure having you. If someone wants to reach out to ask you a question, either about the career or they're in the Cape Cod area and want to explore coming to visit you for anything, what's the best way for someone to get a hold of you or check you out?
Yeah, so they can go to our website, capeconciergept.com, or they can email me directly, ashley@capeconciergept.com. We do have an intern this summer. Our internships are usually quite coveted, so we're always looking to help people. People can always observe or just check us out if they want to see kind of this version of physical therapy.
Perfect. We'll link all that on the website as well, and probably in the show notes there. So, Doctor of Physical Therapy, Ashley Katzenbach, everyone. Hope you enjoyed today's episode. If you want to explore other careers or share yours with us, please check out our website. Until next time, go Bills. And finally, go Sabres.
I'm